Okay, we are still in our discussion about antihypertensive agents. So nasugdan na nato ni siya and we are done discussing sa ato ang first group of drugs used for hypertension, and that is our diuretics. So we are done with that. We will now move on to other groups of drugs used for hypertension. We have sympathoplegic agents, direct vasodilators, and those that block production or action of angiotensin. So medyo daghan-daghan pa. But anyway, most of these drugs actually nahuman na nato og discuss sa Pharmacology 1. So this will just be a sort of review sa inyo, ha? I hope class na na-retain pa to siya sa inyong mga utok. But kung medyo nakalimot na, please review. I hope you can still access my recordings sa PICOL 1. Please review especially sa sa parasympathetic o sympathetic nervous system nato na discussion. If you listen to the testimonies of our board passers last time, di ba, they told you that mostly sa PICOL ang nigawas kay simpa o parasimpa. So pila na siya ka years ang the same ang ilahang ginaingon, pila na ka batches ang nagaingon na ang mostly nagagawa sa pharmacology na area sa board exam kay simpa o parasimpa. Na this is just a continuation. Kasi remember, when we discussed sympathetic nervous system class, this one, norepinephrine is always connected with the blood pressure. Okay, mao gid na iyahang actions. Therefore, balikan nato siya karon. So wala pa muna human sa inyong simpa and parasimpa. And mo pud na ako ingon tong atong discussion sa PICOL 1 na if you have fully understood simpa and parasimpa, most likely you will ace other topics sa pharmacology. Okay? So let's move on. We have again drugs that alter sympathetic nervous system. So a little review, when you say sympathetic nervous system, this is what we call, what is that again? What's the other name for the sympathetic nervous system? Let's have our recitation. Let me write this, record this. Anyone? What again is the other name for our simpa and parasimpa? Kalimot, ay, simpa na lang. Simpa lang sa. Wala na, kalimot na? Yes, Belly.
Fight or flight, ma'am.
Okay, very good. So, when you say sympathetic nervous system, sympathetic, that is what we call the fight or flight. Fight or flight nervous system na to. So it's either when you're faced with a situation, either you fight or you flight. Okay? Now, another question. What is the major neurotransmitter for the sympathetic nervous system? Again, what is the major neurotransmitter for the sympathetic nervous system? Major neurotransmitter. Anyone? Okay, Sarah, we have here norepinephrine. So do not forget, ha, do not forget when you say sympathetic nervous system, the major neurotransmitter, especially in the postganglionic neuron, is the norepinephrine. So norepinephrine is a neurotransmitter. Now, another question. What is the difference now between norepinephrine and epinephrine? Pinakauna lang ako ilista, ha. It's either pinakauna ka nag-raise of hand or pinakauna ka nag-send of chat. Again, what's the difference now? between epi and norepi? Yes. Okay, Christine. Nauna si Christine send chat. Epinephrine is used to treat anaphylaxis, cardiac arrest, and severe asthma attacks. Norepinephrine, on the other hand, is used to treat dangerously low blood pressure. Okay, but I want to know, I want you to tell me the difference in terms of their origin. Not yet on their pharmacological use. Kasi actually, that is correct, Christine, that epi is used for anaphylaxis, for cardiac arrest, for severe asthma attacks, and that norepinephrine is used for very low blood pressure. But nevertheless, I'll just give credit sa inyo. Okay. And yeah, that is correct also. Okay. We have here belly. Epinephrine acts as hormone while norepinephrine acts as a neurotransmitter. That's the answer that I'm looking for. When you say epinephrine, it most likely acts as a hormone since it is produced by the adrenal medulla right above the kidneys. The adrenal medulla class is a gland, an endocrine gland. So pag gland na siya, ang gina-release na niya hormone. Pero si norepinephrine is produced by the adrenergic neuron. That is why neurotransmitter siya. Pero actually, the same ang ilahang action, the same ang ilahang neurotransmitters. Receptors of ilahang pharmacological action. Alang gamay kaayo nga difference. Okay? Now, another question. What are the receptors of the two, norepi and epinephrine? What are the receptors of the two, the norepi and the epinephrine? Okay, we have here alpha 1, alpha 2, and the beta receptors. So we have 3 beta receptors. We have beta 1, beta 2, and beta 3. Beta. Okay, alpha 1, alpha 2, beta 1, and beta 2, and beta 3. So alpha 1 class, do not forget, makita na siya sa blood vessels. And ihang action ana, pag si epi o si norepi mag-bind sa alpha 1, there will be vasoconstriction. So pag na-vasoconstriction, there is increase in the blood pressure. Now, si alpha 2, makita na siya mostly sa mga smooth muscles, but board exam question, alpha 2 receptors are found presynaptically. So pag maingon kag presynaptically, it's before the synaptic cleft. Now, pag imuha na siyang i-activate through the binding of epinephrine and norepinephrine, the result of that is there is an increase, there is an inhibition in the further release of the neurotransmitter norepinephrine. So I hope nag-take note mo. I will no longer write that sa screen because we are done with that sa PCOL 1. Gina-review lang ta mo kay balikan nato tong mga drugs involved din ha. So again, alpha 2 is found presynapse. And ang iyahang action when activated is mag-inhibit siya further release of norepinephrine. Okay? Next, we have the beta 1. Beta 1 is found in the heart. In the heart. Sa heart na siya So pag imuha na siyang i-activate, there will be increase in everything. So increase sa chronotropy, that's the heart rate. Increase sa inotropy, positive inotropy. So that's for the force of contraction sa heart, and increase sa dromotropy or the conductance of the heart. And then beta 2 is found sa lungs or sa bronchioles, and if you activate that, what's the action for the beta 2? If you activate beta 2 sa lungs and sa bronchioles, there will be what? There will be broncho-Sara relaxation, and when the bronchioles relax, meaning there is bronchodilation. Okay, bronchodilation pag mag-relax ang mga bronchioles. Okay, and lastly, we have beta 3 sa fats that will induce lipolysis or breakdown of the fats. That's for the receptors of the neurotransmitters and the hormone norepi and epinephrine for the sympathetic nervous system. Excuse me. Now, let's move on. Let's talk about the drugs that are called sympathoplegics and that they are used as treatment for hypertension. So we have here the four drugs. We call them centrally acting sympathoplegics. Centrally acting because they will have their action in the receptors of the brain. Okay? Receptors sa brain. Kaya centrally acting sympathoplegics. So we have here methyl-dopa, clonidine, guanfacine, and guanabens. But as far as I know, only the methyl-dopa and clonidine are available in the Philippines. The two drugs sa baba are available in other countries. Now, what are the mechanisms of action of these four drugs? They are class alpha 2 agonist. So a while ago, I have mentioned where is the location of the alpha 2 receptor. When you say alpha 2 receptor, this is a board exam question. This is found sa pre-synapse. Pre-synapse. Meaning before the synaptic cleft, if you will draw again the end of the neuron, it looks like this. And then we have the receptors here. The space here is what we call the synaptic cleft. It's the area between the ending of the neuron and the next na cell, which contains the receptors. So alpha 2 is found pre-synapse, meaning it's before the synaptic cleft, while all the other receptors are found post-synapse. So you have alpha 1 and the beta receptors here. Now, if norepinephrine and even the epinephrine binds at the alpha 2 receptors in the presynapse, it will result in the inhibition of further release of norepinephrine. Again, if you activate the alpha 2 receptor, it will result to the inhibition of the further release of norepinephrine. So ang tendency, remember di ba natay vesicle din ha, and then this is where we find the norepinephrine. If atuan ni siyang i-activate dinhi, kanang naa dinha sa vesicle will no longer be released. Magstay na siya dinha. And if dili na siya ma-release, walay increase sa amount of norepinephrine that can bind to the receptors sa post-synapse, especially the alpha 1 receptor, which can increase the blood pressure of the person. So that is the reason why, class, na these 4 drugs, which are considered alpha-2 agonists, are used in the treatment and management of hypertension. Okay? Naga-inhibit siya sympathetic outflow in the periphery. So walay norepinephrine, there will be no increase in the blood pressure. That's alpha-2 agonist. We have the 4 drugs again, methyl-dopa, clonidine, guanfacine, and guanabens. Questions so far about these 4 drugs and their mechanism of action? Asa dapit din hiyang wala na sabtan? Wala. Magpadayon ko ha. Pag wala question, magpadayon ako. So we have here methyl-dopa. Let's discuss them one by one. Methyl-dopa, from the name itself, dopa, you should have a hint there that it's an analog of something like dopa or dopamine. But to be specific, methyl-dopa is an analog of the levodopa. Now, inside the body, again, inside the body, methyl-dopa will be metabolized and it will be converted into alpha-methyl norepinephrine and alpha-methyl dopamine. Okay? Duha na kabuk iyahang metabolite, alpha-methyl norepinephrine and alpha-methyl dopamine, which are considered as pseudo neurotransmitters. Pseudo-neurotransmitters, meaning fake sila na neurotransmitters. Though even if fake sila makonsider, they can still bind to the receptor. So muna din nga ayahang MOA. Actually, ang MOA ni methyl-dopa, katog yun, alpha-2 agonist yun siya. Pero paano siya nag-bind dito sa receptor sa alpha-2? Due to the release of the metabolites, kana silang duha, kay tungod fake neurotransmitter man na sila, they have almost the same structure with that of the norepinephrine and the dopamine. So they have the ability and the affinity to bind sa receptor, sa alpha-2 receptor, and then they can activate the receptor. Once activated, kung unsa tong trabaho gyud ni alpha-2 receptor, magyud toy mahimong action ni methyl-dopa. Now, the innovator drug in the market is called Aldomet. And board exam question for methyl-dopa number 1. It is our drug of choice for pregnant women na naay hypertension. Again, drug of choice for hypertension in pregnancy. Kasi most of our antihypertensive drugs are teratogenic, meaning, what do you mean by teratogenic, by the way? Anyone here who knows what teratogenic means? I'll wait. I want the specific one. I want the specific meaning before ko maglista o pangalan din. Okay, Quincy. Okay, disturb the development of an embryo or fetus. That's what you call teratogenic. Again, ang iyahang ang effect niya is on the development of the fetus, so that when ipanganak siya, ang baby, na ay mga deformities, na ay kulang, pwede nga upat lang iyahang tudlo, isa lang iyang kamot, kulang iyahang mga tudlo sa tiil. That's what you call teratogenic na effect, na ay abnormality during exposure sa pregnancy. So again, most of our antihypertensive drugs are teratogenic. That is why si methyl-dopa lang ang dili teratogenic. So that is the reason why this is the drug of choice for hypertension in pregnancy. So I hope dili mo makalimutan na ha. Low carb diet. Okay? Now, toxicity. Remember that these drugs are centrally acting, meaning they bind to the alpha-2 receptors found in our brain. So sa ato ang brain mismo sila nag-act, That is why ang ilahang toxicity pod class kay sa mental functions pod nato. Okay? Mental functioning nato. Halipog kasi mga uncertain nga ng low carb diet mo gi-answer. Natingala ko that you are all answering like harmful sa baby, harmful sa fetus, may negative effects sa baby. Tapos may cause a birth defect sa child and so on. Tapos nag-chat ka kalit og low carb diet. moto tingala ko kagay na asa daw low carb diet sa gikan Christine. Okay. Sige. Again, ang toxicity kay sa mental functioning ha kasi this drug binds to the receptor sa brain. So that is why when you look at the list of toxicity, we have here the sedation. These are the side effects. Sedation, impaired mental concentration, nightmares, vertigo, and mental depression. So kung i-consider nato ang side effects ani nga drug, so extension lang pud sa iyahang activity on the brain. Next board exam question about methyl dopa. It can develop positive Coombs test. Again, positive Coombs test. So what is Coombs test class? Coombs test is a test to diagnose hemolytic anemia. Again, Coombs test is a test used to diagnose whether a person has hemolytic anemia. When you say hemolytic anemia, it is where the red blood cells hemolyze. Mag-hemolyze siya mo, kalit lang siya o lyse or mubuto lang siya kalit. So the person develops anemia. We call that hemolytic anemia. By the way, let me add, kasi wala din siya sa screen, it's not actually positive. It's not really positive, but it's a false positive result. Kasi the person has no hemolytic anemia, but when he or she takes methyl dopa, pwede siya mag-positive sa test. So, false positive lang ang result. False positive Coombs test. So, please take note, kaya wala na sa ako ang slide. Kasi wala mo na minaw din ha. Unya, pagkahuman ang ako mga quiz. Kaya ganahan ba kay kuan na, labi na tong face-to-face ang klase. Nahan kay kuan ng ako ang quiz kay kanang wala sa ako ang slides. Kanang ingon lang na ako. So, mo na siya nga during the face-to-face class akong pharmacology. Daghan jud kayo cellphone sa ako ang atubangan kay magsige sila record. So may maning sa inyong hakaron kay apilong video. So everything is recorded. Hatag na ko sa inyo sila kay maning kamot sila sarili nilang record. So muna nga murakog nag-conference kung nagaklase ko kay daghan cellphone sa katubangan. Okay, we have clonidine. The next one, the clonidine. The same thing, the same with the methyl dopa. This is still centrally acting, thus the hypotensive activity is still on the alpha-2 receptors found in the brain. Marakog nagsona. Marakog nagsona, dahan kayo cellphone, kay magtagsaman sila og recording. Daghan po ang mabilin nga cellphone, kaya pag human og goodbye class, mulakaw na sila niya. Wala nila gikuha ilang mga cellphone sa akong atubangan. There were times na daghan kay kong bit-bit nga cellphone pag moadto ko sa sa faculty room. Daghan po daw mga times nga ginabinoangan ako sila. Labi na basta isa lang kabok ang mabilin nga cellphone. Ako man ang taguan ng ilang cellphone. Magkabuang na sila pangitag sa ilang cellphone. Wala. O gina siya. So we have clonidine it can bind to alpha receptors but it's more active sa alpha 2 receptor. So hypotensive gyud ang iyahang activity. Now, innovator drug in the market, we have the catapres. So do not forget, we have here the catapres. Now, clinical application. When do we use the clonidine? Kasi si methyl dopa, we know that this is the drug of choice for hypertension in pregnancy. Now, clonidine, kano saan nato siya gamiton? This one is actually a reserved drug. If the hypertension or the hypertensive person is not responding to treatment with 2 or more drugs. Example, nagagamit na siya amlodipine, gipartneran pag hydrochlorothiazide, gidugangan pag losartan. So daghan na kay siya tambal, but then again, unresponsive na siya sa ato ng mga treatment. So pwede na nato gamiton si clonidine. And aside from that, we can also use clonidine if the hypertension is complicated by a renal disease. So pag nana na siya kauban nga kidney failure, again, we can use the clonidine. So nganong dili man ni siya first line drug or first choice or drug of choice? Kasi kani sila methyldopa, kagaina pa nako ginabalik-balik sa brain ilahang action. So ang ilahang toxicity is sa mental functioning pod sa person. So aside sa dry mouth, it can cause sedation and the patient will be at risk for depression. So we don't use this if ang person atong patient kay depressed na daan. Pwede din ang clonidine sa ADHD. Yeah, but it's not really that much used sa ADHD. It's more on the hypertension pa. Pero don't use this if the patient is experiencing depression. And another thing that you have to know about clonidine, this is a drug. This can be a maintenance drug for hypertension, but we don't withdraw the therapy abruptly. Kay it will cause hypertensive crisis. Mura siyang mag-cause og rebound na hypertension. So dili pwede nga, uy, okay na ang ako ang BP for 1 year, nagsigig take ani ang patient niya, okay na yung BP niya, ikalit ni mo og undang ang therapy. Dili siya pwede. Kailangan tapered ang dose, i-decrease na to ang dose gradually until maanad ang patient na wala na siya clonidine in the body. Now, when you say hypertensive crisis class, I think na-mention ko na sa inyo sa una pa, hypertensive crisis happen when the BP is like less than or equal to 180 over 120. Again, more than or equal to 180 over 120 na blood pressure. Now, this one is divided into two. Classified into two. It can be called a hypertensive urgency or hypertensive emergency. Ang inyong tandaan, pag urgency, ang BP lang niya kay 180 over 120 mmHg or more than that. Pero pag moingon na kag hypertensive emergency, ang BP ana niya 180 over 120 plus there is end organ failure. Mana ilahang kalahian duha. Classification na sila sa hypertensive crisis ha. Hypertensive urgency if the blood pressure is equal or more than sa 180 over 120, but if naanay end organ failure, for example, naapektuhan na ang kidneys, nagkaroon na og kidney failure and end organ failure, terminal nga case, it's called hypertensive emergency. Okay? Questions? Wala. So let's move on. Now, how about guanabenzene, guanfacine? Brand names na nilang nasa open and close parenthesis. They are not available in the Philippines, but they have the same mechanism of action with the previous drugs, the 2-methyldopa and clonidine. But this is rarely used, so that is the reason class na wala na siya diri sa Pilipinas. Remember sa ato ang hospital internship, ang pagpili sa drug nga gina-include sa formulary na ay mga criteria. It has to be cost-effective and so on, including the list of the toxicity. Atong i-apply ato ang hospital internship din para dili siya kanang in vain lang na kanang for the sake nga nahuman ninyo inyong hospital internship, so dapat na amoy natun-an didto. Ug atoan na siyang i-apply diri sa pharmacology. So mo na siya rarely used. This may be due to its their toxicity. So mo na nga kung sa mga formulary atong tan-awon, they are not that included. Okay? Katong duha included sila kay kani para sa pregnancy, kani pag di na mo respond sa uban nga treatment ang patient. Pero kung the same ang good nga mechanism of action class niya ihatag nato siya sa patient, ang tawag nato na duplication. Okay? Duplication kay the same man nga mechanism of action, so why give two drugs that have the same mechanism of action? Mo na siya pirmi ang thinking sa clinical pharmacist pag i-check niya ang drug sa patient. Okay? Any question about our centrally acting sympathoplegic agents? Okay? Wala. So let's move on. Ganglion blocking agents. Who can still remember what ganglion is? Again, who can still remember here what ganglion is? Anyone? What do you mean by ganglion? Kalimtan na? Past is past din yung motto sa life class. Past is past. Nakalimot na lang sa ganglion. Ganglion ha, ganglion. Location sa simpa at parasimpa. Kung saan nga location, Jessa? Kasi nasaag naman mo. Abnormal benign swelling, maglaki ang joint. Sa Google ni sila ba? Okay, tanaw na ito sa magawa sa Google. Uy, ka-slow sa akong cellphone. Ganglion. Tama lagi ko na Google ni sila. Tama dyan ko ba na Google dyan sila kaya ang una dyan nigawas diri ang ganglion cyst. Una ilahang answer kay inflammation sa joints and so on. Di, class, tandaan nga inyong research din ha, ganglion cyst, dili ganglion. Ang inyong inatanaw, ganglion cyst ha, dili ganglion. Okay. Ba? Kinsa una nakatama din eh. Okay. Kaya nag-google na sila.
Ma'am,
Ano siya, ma'am, sa junction between neurons, ma'am?
Kinsa na yung istorya? Janabel? Ano sa tawad, Janabel?
Joint or junction between neurons po.
Okay, very good. Wala akong napangitang answer. Remember class sa atuang discussion sa simpag para simpa, nag-draw ko og neurons. Diba si simpag para simpa, if this is the brain here and the spinal cord here, si simpa o si parasimpa, it has, they have two neurons each. Like this one. Ang isa kay mas taas, ang isa gamay, the other one kay mas mubo iyahang first neuron, ang isa mas taas iyahang second neuron. Bayon ko sa inyo ha, this junction here class is what we call the ganglion. So that is why this first neuron here is called preganglionic neuron. And then this one here is the so-called postganglionic neuron. Kasi again, this is class the ganglion here. Mana akong ginapangita sa sa answer. Ang-answer nakabeli. Asan to ba? Let's look at the time. Okay, ask ang answer. Sabay-sabay ng mga answer, okay? Sige. So again, this is what you call the ganglion here, ha? And then, mo ni ang last din, di ba mag-end ni sila sa organ, daghan man na siya og nerve terminal, so sa mga organ na siya mag-end. Pero if this is sympathetic nervous system, norepi na siya tanan. Kani pag parasimpa, acetylcholine. Kung asa man na siya mag-end ng organ, acetylcholine ng neurotransmitter. But, di ba, ingon ko, board exam question, the neurotransmitter sa ganglion for both sympa and parasimpa is acetylcholine. So again, board exam question. Neurotransmitters found in the ganglion of both sympa and parasimpa, acetylcholine. Dito na sila nagkalahi sa postganglionic nerve ending. Kay si sympa norepi, pag parasimpa acetylcholine. Okay? Do not forget that. Those are board exam questions. Now, let's move on sa third group kay diuretics tapos centrally acting sympathoplegic agents. So ikatulo na ni ganglion blocking agents. Mechanism of action nila sa name pa lang class, sa name pa lang nila dapat makabala sa name pa lang sa group sa drugs. Kabalo na mo sa ilang mechanism of action. They block the ganglion, the receptors in the ganglion. So unsa to siya? To be specific, ganglion blocking agents inhibit the nicotinic cholineceptor on postganglionic neurons in both sympa and parasimpa. By the way, it's postganglionic neurons, so let me check that one. So for example, this is ganglion here, sorry. And then we have this one, preganglionic, postganglionic neuron. So diri na siya sa postganglion mag-take og action sa receptor din ha ni nicotinic receptor. Kay di ba ingon ko ang receptor nga naa sa ganglion is the receptor ni acetylcholine. And then ang receptor ni acetylcholine duha lang man to kabuok, muscarinic ug nicotinic. Dili parehas kay norepi ug kay epi, kay lima kabuok alpha ug beta. Kani specific ni siya kay nicotinic receptor that is found in the ganglion pero specific on the postganglionic nga part. Okay? Pero both sympathetic and parasympathetic na ganglia. Parehas sila. Kay parehas man ilahang neurotransmitter, so parehong receptors nila. So again, ang unsang ginablock ang nicotinic receptor. So they block the action of acetylcholine sa nicotinic receptors found in the ganglia of both sympa and parasimpa. Now, before we talk about the drugs, let's talk about, let's call it side effects. Let me recheck para dili mo malibog. Kay i-apply na to ato ang, asa na to? Kadot. Apply na to ato ang natun-an class sa inyong HPI. Muna siya connect na nato ni Karon. Let's call this side effects. Nganong side effects? Because these effects are extensions of their pharmacologic or pharmacological effects. Meaning when they block the nicotinic receptor in the sympathomimetic na region, ang iyahang effect is the excessive orthostatic hypotension and sexual dysfunction. Diba? Pag muingon magugag sympathetic nervous system, especially si alpha 1, mutaas gyud imong BP ana kay it will cause vasoconstriction. Therefore, if you block the sympathoplegia, I mean the sympathetic na nervous system, the effect will be hypotension. And then sa parasympathoplegia, remember si acetylcholine causes dumbbells. Dumbbells, can you still remember dumbbells? Diarrhea, urination, meiosis, bronchodilation, emesis, lacrimation, and sweating, and even salivation. So basa ito tanan. Now, pag i-block ninyo si acetylcholine, kay blocking agents man ni sila. So you will have the reverse of those na akong gi-enumerate. Constipation, dry mouth, urinary retention, and so on. So extension sila sa pharmacologic effect. So mahimo na sila og side effect class. Okay? So unsa ang mga drugs under the ganglion blocking agents? We have here, actually, isa rin eh, mecamilamine. The brand name is Inversin. Drug lang, isa lang siya. Again, mecamilamine, or the brand name is Inversin. Though I have not yet seen mecamilamine so far, pero dugay naman gug wala nakasulod og pharmacy, hospital man na or community, so wala ko kasulod if this drug is really available. Dili man pud gud ni siya first line drug for hypertension, so mag-expect pud ta na wala kay siya ginagamit. So kung sa mga hospital, they don't include this sa formulary. I don't know with the PNBF. I have not checked whether mecamilamine is in the PNBF. Therefore, if the doctor prescribes this to a patient admitted, most likely dili siya appeal sa PhilHealth. Okay? Ulit-uliton. Adrenergic neuron blocking agents is the fourth group of drugs for hypertension. Adrenergic neuron blocking agents. Kay katong kagaina sympathoplegics, agonist man to sila. Again, agonist. Kani kay blocking agents. Pag blocking agents, they are called antagonist. So sa asa sa adrenergic nato na mga receptors. So their action is actually dependent in their binding in these receptors, pero the binding is baliktad ha, antagonism. So when they antagonize the binding of norepinephrine to these receptors, this will result to the decrease in the blood pressure. So aside from that, before ta mag-istorya og mga receptors, let's have first on the production of norepinephrine. Diri sa ta sa guanethidine, guanadrel, and the reserpine. Na-mention na nako nitong nag-drawing ta paano ma-produce si norepinephrine. So we have here guanethidine, the first one. This one is rarely used, so you cannot also see this sa mga pharmacy. And this is too polar to enter the CNS. Let me draw again. Balik-balikon dyan nato na. No? Syaro, di mo katubag sa board exam kung simpa o parasimpa gihapon ang ganahan maguna sila magsige question og simpa o parasimpa sa board exam. Di ba pag itong naghimo tag ingani sa production sa norepi, as it nag-start, we have here the tyrosine. Tyrosine will enter. It will become dopa. After that, mahimo siya, isulod siya sa vesicle, and then this dopa, dopamine siya. Usa siya isulod sa vesicle. So pag sulod na siya sa vesicle, dopamine will become norepinephrine. And then, summary na lang niya, balikin ninyo totong lesson. And then through the action of calcium here, there will be fusion of the vesicle and the membrane of the neuron, and then gates will open, the synapse and the vamps, and then norepinephrine will be released using the process called exocytosis. So this one is the synaptic left here. The receptors are found post-synapse, the 4 types of receptors, while the other one is found pre-synapse. Okay, so di ba mao niya siya, gisimplify lang nako ha, ang pag-produce. Now, di ba na, kung ma-remember ninyo natay mga drugs nga naga-inhibit, just like this one, we have the metyrosine here that will inhibit the entrance of tyrosine inside the adrenergic neuron. And then the vesicle here, di ba natay transporter called the VAT. So, ang napoy mag-inhibit ana, and that is the not the VAT, the VMAT. Sorry, let me check that it's the VMAT. vesicular monoamine transporter. So this is being inhibited by reserpine, and the opening here of the SNAPs and the VAMPs is this one. Kani sila ang mag-inhibit. So we have now the first drug here, the guanethidine, and also the guanadrel. The action is the same with the guanethidine, kaya mo man na ilahang trabaho. But this one is available in the US. Pero take note, mechanism of action. These two drugs inhibit the release of norepinephrine from the sympathetic nerve endings. Again, these two drugs, guanethidine and guanadrel, inhibits the release of the norepinephrine from the sympathetic nerve ending. If you look at my illustration on the screen, asa siya nakapoint, ang inhibition niya is in the opening of the SNAPs and the VAMPs. Diba? Those are the gates na pag ma-open na siya, makagawas na si norepinephrine, maadto na siya sa synaptic cleft. Okay? Inhibit na niya. Nilang duha, ni guanadrel ug ni guanethidine. Questions about these two? These two drugs? Hala. And nevertheless, these are not really available in the Philippines. Now, toxicities. Actually, the toxicities here are the side effects. Severe orthostatic hypotension and sexual dysfunction. Pag gina-inhibit yun ninyo class ang trabaho ni norepinephrine, always yun na siya nga mag-result into hypotension, especially orthostatic hypotension, and it will also result in sexual dysfunction. So kani kay nakulang man ang supply ni norepinephrine, kay wala naman siya nakagawas from the adrenergic neuron, so kulang na pod ang mag-bind sa mga receptors. Thus, the side effects. Extension sa effect ni guanethidine ug ni guanadrel. So this one is expected. Okay, expected niya nga toxicity. And then we have another drug. What time is it? Before we'll end, we have here the reserpine. This one is an alkaloid. So, di ba pag alkaloid, it's a phytochemical. It's coming from a plant called Rauwolfia serpentina. Again, Rauwolfia serpentina. The alkaloid is called reserpine. Now look at the illustration in the screen. Kasi yung gina-inhibit ang vesicle, the vesicular monoamine transporter that transports dopamine inside the vesicle. Isulod siya sa vesicle so that dopamine will be converted to norepinephrine. Kailangan din na siya isulod sa vesicle kasi if you can still remember, inside the adrenergic neuron, we have the enzyme MAO or the monoamine oxidase that is responsible in destroying the catecholamines like dopamine and norepinephrine. So kung i-inhibit nato si VMAT class, dopamine will not become norepinephrine. It will be destroyed automatically by MAO and makulang na pud ang atuang supply sa norepi dinhi. Again, pag kulang atong norepi, pag wala na yung ma-produce, that will lead to the decrease in the blood pressure. So that this is the mechanism of action. Again, simplify lang na ko to kagaina. Nevertheless, reserpine blocks the ability of the aminergic transmitter vesicles to take up and store biogenic amines, probably by interfering with the VMAT, vesicular membrane associated transporter. To summarize, guanadrel and guanethidine inhibits the release of the norepinephrine. So dito sila sa release, but si reserpine is on the storage. So storage ang iyahang action inside the vesicle. So the same toxicities or side effects, mga ano ni sila, extension sa iyahang pharmacologic effect, postural hypotension, lassitude is like the feeling of kanang sad, diba? Kanang murag solemn kayo, gloomy ana. Nightmare, severe mental depression, and extrapyramidal effects resembling Parkinson's disease due to the ability of the reserpine to affect the brain also. Okay? So next meeting, we will continue with our discussion tomorrow sa beta adrenoceptor blocking agent. So we are still class under sa adrenergic or sa sympathetic nervous system, pero mag-concentrate ta tomorrow with the blocking agents, especially sa alpha ug sa beta receptor. Pero question so far, ay Tuesday di karon. Ay nakalimot ko. Tuesday di karon. Wala din tayo meeting tomorrow na lagot ko. Delayed na kayo ko sa akong people. Sige lang tagwalay klase.